Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our Hospital System General Director. Today is Tuesday, December 8th, giving you the update from Albany Med. All right, Fred, so we're going to focus on COVID today.
Yes.
Obviously, that'll be the topic that we'll cover. Let's begin with the 8 counties of the Capital Region. With the graph there, you can see we're up to 220 cases. Now, Fred, we had our regional call this week. There was a time in the beginning where we were doing it every day.
Yes.
Then we shifted back to once a week. Now it's twice a week.
It's back to twice a week, Dennis, because of the tick up.
Anything in particular that you learned today talking to the other hospitals in the region?
So pretty significant double-digit increase over last Wednesday, number one. Number two, we continue to have a relatively small population in ICUs and a relatively small population on ventilators. Both of those are really good.
Good numbers. Good
Yes.
numbers there. Certainly the overall number going up. And then Dr. Fauci this week was mentioning how the national numbers were going up, but we don't think we've seen the full effect of Thanksgiving yet. Right. Is that correct?
Right. He thinks next week and the week after we'll see the full effect of that.
Okay, very good. Next graph is admissions and discharges here at Albany Medical Center, and the graph speaks for itself. You can see what we've been talking about over the last week or so. Interestingly, and we point this out at least once a week, no activity here or really in the region with influenza.
Yes.
Sometimes that influenza season may start in January or February, so we still may see it, but we have not seen any activity yet.
Just one case all season so far.
One case. Which leads us to the next graph, which is the morning census here at the medical center. You can see currently we have 66 in the hospital, 56 on the floor, 10 in the ICU, and to your point, 2 on ventilators. So really only about 1 in 30 in the Albany Medical Center on ventilators.
That's right. You know, Dennis, we have seen a tick up in admissions,
right,
but we're discharging almost as many patients each day.
Yes.
So length of stay has shrunk a little bit as well.
Are the admissions that are coming in primarily from the community? Are they from congregate living? What's the breakdown there?
Dennis, not only here, but all of the hospitals today reported the same thing. Most of what we're seeing is coming from the community, not from congregate living facilities.
Which I guess, again, if you want to look at it, is good news because congregate living often tends to be a very vulnerable population as far as being older, underlying medical conditions. So it appears as though whatever processes have been put into place to protect that population is working.
Seems to be working.
Which is great news. Fred, there is some interest in hospitals and their preparedness for even numbers going up higher. If there's a surge in additional cases, how we will flex our ability to care for the population, not only of COVID, but our traditional populations. I believe it's true we have multiple different strategies. You want to talk about a couple?
We do, Dennis. So going back to our surge plan, which we developed back in the spring,
right,
and we've modified a little bit, we have the ability to get up to about 1,000 patients in the hospital in various places. So yesterday the governor put out that he wants the health department to tell hospitals to be able to flex 25%. Actually, that 1,000 number is closer to 50% for us.
Right.
So I think we're okay in doing that. We've begun to talk about other things, though. So one is shifting some of our what we call extended stay surgery, so overnight surgery patients, to our South Clinical Campus.
Which is COVID-free.
It's COVID-free, and it has the ability to recover people overnight. That frees up a bed on this campus. So we're going to start doing that probably in the next week or so. And we have been talking to our colleagues in the community, some of the other hospitals, about shifting patients around as necessary.
Back in the beginning, we talked about Albany Medical Center being a regional transfer center when we took patients up from New York City who had COVID. I think you're talking about something similarly as far as maybe balancing out some of those patients in the region, if necessary.
That's right, Dennis. So we took over 110 patients from Queens. We acted as the hub, and we worked with Saratoga Hospital, Columbia Memorial, St. Peter's, et cetera, to distribute those patients. So we're now kind of beginning to develop the same kind of thinking where if one hospital is overloaded, how can we help them with transfers here or transfers to other hospitals in the region?
So we're a 4-hospital system: Columbia Memorial, Albany Med, Saratoga Hospital, Glens Falls. So theoretically, we could be able to do some load balancing between the system if we had to.
Right. We have about 1,200 beds without our flex plans across those 4 hospitals.
And the advantage of that is there are certain unique things that can only be done at an academic medical center like Albany Medical Center. And so in order to try to preserve the mission as best as possible, there may be times when we would try to move some patients around to free up capacity at a place where only that work can be done.
That's right, Dennis.
Okay.
Very important for our community.
And I suspect there are many other things we could articulate that are part of that Surge and Flex plan, but those are two of them.
We're getting started on it.
Very good.
Absolutely.
Fred, vaccine, a lot of talk in the press about vaccine, in particular the Pfizer vaccine. Are we any closer to it being approved by the FDA, and what's the likelihood we'll have it here on this campus before the end of the year?
So Dennis, the FDA has actually taken the raw data from Pfizer and reanalyzed it.
Okay.
So that's something very important to understand. So they didn't just take the summary from Pfizer, they actually reanalyzed the raw data themselves. And they actually put out today a 53-page document with that analysis.
We've seen it.
That's right, we have seen it. That's going to be reviewed on Thursday by an independent panel of physicians at the FDA, who will then make a recommendation. So if they go thumbs up, and frankly, having scanned the document, I think you and I both, we think they'll probably say this is a go. We could perhaps have Pfizer vaccine next week.
Which is remarkable. And obviously we've talked about this. We've been thinking long and hard with a multidisciplinary group for a while about how we would begin to roll it out.
That's right.
The goal, of course, eventually is to offer it up to every member of our workforce who would take the vaccine. But in the beginning, we'll have to be smart, and we'll have to prioritize those locations where it's likely that COVID will be seen, and where often it will present in ways where we won't even know that the person has COVID.
That's right.
And I think when we roll it out in those areas, it wouldn't just be specifically only for clinical people. Even the people who are not directly at the bedside but are part of the registration process would be included.
The registration, the transporters, you know, the therapists, everyone. Absolutely.
Because they're all potentially caring for and treating COVID patients.
And you know, it is important, Dennis, to prioritize two groups. So you mentioned one, which are the critical healthcare workers that are going to take care of the sick.
Yes.
The other is the vulnerable population.
Absolutely. Absolutely. Our last topic of the day, and it's also about COVID. Fred, in the beginning and all along, we've talked about being sure that we do not delay care. It is incredibly important. We talk about this all the time, COVID, the importance of COVID. But we have many missions, and we have many disease states that we treat. There's some recent literature that you were talking about that showed what happens when care is delayed.
That's right, Dennis. So a very large group down in Virginia, Inova in Fairfax County, looked at 90 children that presented with acute appendicitis during COVID and compared them to a similar number a year before in the same time frame. Twice as many children presented with ruptured appendices, which, as you know, as an ED doc, is a serious situation. They can get an abscess, etc. And it was all tied to delay. So it's really, really important not to delay the care you need, despite this rising incidence of COVID.
In the beginning, we talked about that as something we were worried about. Now there's literature to support that it's something that is real. So it's a great reminder. Safe care can be provided in doctor's offices, urgent cares, hospitals, ambulatory surgery centers. Wherever you seek care, seek that care. It's important.
Don't delay your care.
Don't delay your care. All right. We'll be back again on Thursday. I think on Thursday, Fred, because we've been at this for a while, we're going to show some graphs that show what the chronicity is of the cases at the medical center from the very beginning to put it in perspective. And we'll have some more information from the region by Thursday
That'll
as well.
be very interesting.
All right. Very good. That'll do it. We'll be back again on Thursday. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 days.